Guys, I can't believe it's the last day of VEDA. How did that happen? April went by so fast. ah, really, though. I mean, I really feel like April just started. Um, but yeah, this has been fun. As you can see, I waited till I woke up to film my last VEDA. I don't know, thought maybe I'd focus better or something. I don't know. I kind of don't want to stop though. I've really enjoyed this. Maybe I'll do like Vimdim vlog most days in May. Yeah, maybe not. I don't know. You can let me know if you would like me to continue doing vlogs similar to the ones I've been doing on VEDA. Just kind of rambling, talking about my day or whatever I happen to kind of be thinking about right now. And I will also probably be trying to do a few other things that are in my mind, but I'm not sure when that's going to happen. My May is crazy, so we'll see. Hopefully I'll be moving in May, so that'll be fun. So today, what I want to talk about, I've decided, is comfort care and kind of why I'm such an advocate for families putting their patients on comfort care. It's kind of a hard topic to talk about because in every case and every person is so specific and individual, and it's hard to put any sort of broad claim over medical illnesses, especially brain issues, because we have had people who you're like, there's no way they're going to live, who walk out of the hospital. So even, like I don't even really have a good gauge. I've only been there a year, but even nurses who've been there for longer, I feel like the longer you're there, the more you're like, you have no idea, because the more cases you have where you're like, that wasn't supposed to happen. But that being said, that anything is possible, a lot of times when we have these meetings and families say, do everything, be aggressive, do everything you can, I don't think they realize what they're asking for. And I don't think they realize what they're actually doing to their family member. And they're thinking from a very selfish perspective because they don't want to let go of their family member. They don't want to feel like they're just letting their family member die. So like, oh, I have to fight for them. And so I'm doing everything I can to save their life. And so mom and dad won't hate me or whatever. But if you really stopped and thought, what would mom want, or what would dad really want? Would they want to be laying here in the bed like this? Would they want all these tubes being shoved in them? Would they want nurses to be pinching them every hour to see how they responded? Would they want us to be throwing lines in them and throwing massive amounts of meds at them, probably end up getting an infection on top of everything else, and then the last days of their lives be on a tube, intubated, struggling against, like not breathing well, getting pinched and poked and prodded, and having to continuously just everything. It's just like when you're sitting there like trying to put a new IV in somebody who has no veins left, and you're like, why are we doing this right now for this person who, God love them, God bless them. I don't necessarily think that they're going to recover, and the family wants to feel like they've done everything. But when I look at patients whose families have done everything versus patients whose families have realized to put them on comfort care, have been able to accept that mom or dad is dying, those families are a lot different. And I feel like that the deaths are different because mom or dad who you've decided to be aggressive and do everything for, well, you're going to end up with two things. One, they're either going to end up dying in a code where we start coding them and pushing on their chest and pushing more drugs in their body until you say, okay, you can stop now. Or we say, okay, we've done everything we can and that's it. So their last moments of life are broken ribs and people on top of them and crazy doctors in the room and crazy commotion. So it's either going to be that, or it's going to be that you end up traking and pegging them and giving them just enough sustainability to be able to live off a ventilator for years, even though they are never coming back. They're never going to wake up and respond to commands again. And you know that mom or dad doesn't want that. In fact, like, I have a family member say, well, I know mom or dad wouldn't want to be laying here in the bed like this, but, I need, I feel like I just have to do everything we can. And sometimes the better option is to say, okay, let's stop. Because those deaths, that's the death that I had on Wednesday, was a family who had said, this isn't what they want. If this is what you're saying is the prognosis, if she does recover at all, then that's not what, we don't want to be aggressive. We want to let her go. And those family members, their last moments alive are surrounded by family, with family sitting at the bed, maybe in bed with them, being able to whisper in their ear, being able to peacefully go. They're very different deaths. And I feel like if family members realize what they're asking, they wouldn't ask for it so much. And if they were able to step back and realize that they're being selfish, they would stop being selfish. So for me as a nurse, like, I can stare at this patient and say, if you were here right now, you would tell me to stop. If this was my dad, if this was my granddad, I would tell you to stop. And yet I have to keep going because the family wants to be aggressive with a 70, 80-year-old man who has blood all over his brain and is only responding to pain and has only been responding to pain for a week and is now getting pneumonia and is on a cooling blanket and is pooping all over himself 4 times a night, so he has to be rolled and moved and like, it's not happy, and it's not what I would want. Okay? Don't do that to me. I want the death surrounded by family, if I'm getting a choice here. So, I don't know. Those are kind of my thoughts. I'm a huge advocate for comfort care. It's hard because when things happen suddenly, you don't want to let go. But I see them at the point where the prognosis is what it is. And I think you need to think about what is the best outcome of life. What are they going to return to? Are they going to return to their baseline walking and talking? Or is this laying in the bed, maybe being able to look at you, their baseline? Because I don't think anybody wants that. For me, I guess it's easier too, because since I believe in heaven and I believe that there's life after this, that I have eternal life waiting for me, while death is sad, it's not the end of the world. So, I don't know. This is a very long video now, and I don't really know what I can edit out. So, I can just deal with it. 2 super long videos in a row. Hope you guys have enjoyed VEDA. And like I said, I'll probably do some more videos. And don't forget to be awesome. You can't see it. I can't get the angles on my hands in the light. Yeah.